Welcome to What Healthy Couples Know That You Don't, a podcast dedicated to helping you create the relationship you truly want.
Facing the complexity. How to understand difficult relationships with personality disorders. Personality disorders represent a complex and often misunderstood realm of mental health, characterized by repeating patterns of behavior, cognition, and inner experience. These disorders can significantly influence how an individual perceives themselves and interacts with others. Understanding these disorders is critical, especially when navigating difficult relationships with those affected. The interview aims to shed light on personality disorders, offering insights that can improve understanding and communication. Developing a relationship with someone who has a personality disorder can present unique challenges. Individuals may respond in ways that are hard to even begin to understand, often leading to frustration for both parties. For example, someone with borderline personality disorder may struggle with intense emotions, turning love into despair. On the other hand, individuals with narcissistic personality disorder may exhibit self-centeredness that can leave others feeling as though they are always in an audience watching the stage without they having a role. Acknowledging these dynamics is the first step toward developing a healthier relationship. While understanding personality disorders is essential, it's crucial to avoid making hasty diagnoses of others. Labeling someone can lead to false beliefs, and even a qualified mental health professional can struggle to provide an accurate diagnosis. Instead of jumping to labels, focus on behaviors and patterns that affect the relationship. With the help of social media, it's become all too easy to categorize someone else based on surface-level observations. The information is valuable, but there are some recording issues towards the end. To help us navigate this complex subject, today's guest is Laura Dabney, MD. She is a psychiatrist, relationship expert, and founder of RelationshipRx.com, a coaching and education platform focused on clarity in complex relationships. For over 2 decades, Dr. Dabney has worked with high-functioning adults struggling in painful relationship patterns, often involving personality disorders, helping them understand what's really happening beneath chronic conflict, emotional volatility, and repeated relationship breakdowns. A long member of the American Psychiatric Association and the APA, the American Psychoanalytic Association. Dr. Dabney has been a quoted expert in many national outlets. Her website is drldabney.com, and her newest book, coming out June 9th, is I Need You, Now Go Away, Reclaiming Your Life When You or Someone You Love Has a Personality Disorder. Thanks so much for being here today.
Thank you very much for having me.
I want to begin with your dedication in the book, which I really appreciated. For, quote, for everyone who's been labeled before they were understood. I just thought that was heartwarming to me. I was particularly touched because many years ago, I went to a workshop on personality disorders. There were probably 75 to 100 people there, and the workshop leader said, how many people here believe personality disorders can change? And I was one of 3 or 4 that raised our hands, feeling really like, oh, goodness. But it's what I believe. And she said, astutely, maybe that's part of the problem. And I really love that she shifted because there's been such negative attachment. I mean, even in the old days when I was doing insurance, I wouldn't fill out Access To because it meant they weren't going to give you enough sessions. They would give you 10, but they weren't going to give you any more than that. So I kind of went through a long period of time of not diagnosing Access To in my head, but not on the form. So would you talk about your dedication and explain what personality disorders and superheroes have in common? I love that in your book. And the one common denominator they all share.
I just love your story, and I can relate to that personal story. In medicine, when I was doing my training in residency, the other doctors or on other floors would call us to do a consult with their patients, their surgical patients or their medical patients, because they were Access To, had a personality disorder, and they just were at their wits' end. So I started off buying into that this was just a horrible thing to have to deal with. I was never going to deal with it. And then when I started my practice, I realized I have a whole practice of very, very successful people with personality disorders, and I really enjoyed working with them. So I had this huge turnaround in my belief as well. And to further emphasize that in the book, I do mention fictional characters, lovable fictional characters who have extreme traits, because people with personality disorders, superheroes, have extreme traits for normal human problems or conflicts. And just like the superheroes have super strengths, they're super great for certain situations, but in other situations, that hurts them. So people with personality disorders aren't broken people, they're just people with human reactions that go a little bit extreme and ends up hurting them.
And hurting the relationships that they're in.
Yes, which hurts them. It's like this vicious.
One of the ways I would diagnose is when people would talk about their loneliness and layers of relationships that didn't work, and helping them understand what that might have been about. And it is a very complicated thing, and I really am disturbed that the internet is just labeling people left and right, and it's not something I feel casual about in diagnosing, though I certainly don't have your experience.
So true, and I really started noticing this pattern of this push-pull pattern. So in relating to, all healthy relationships have to have closeness and distancing to be healthy. And we all have a little pain with closeness. We might feel like we've lost a little bit of ourselves, and we all have a little pain with distancing. We feel a little lonely. But people with personality disorders, again, are just reacting to those more extreme. They have almost a phobic reaction to these. So they are just trying to cope with this conflict, and they do it in different ways. The other thing, not only are they maligned in the internet and in the media, but there's a complete misunderstanding that that's all it is. These broken people, but they're not broken people. And I also wanted to bring up that there's this other end to that spectrum, from the people who deal with that conflict by being narcissistic or being over dramatizing everything, like the borderlines. There's the people who withdraw, and they're the people who act helpless as a way to deal with that conflict. That's the other extreme, but it's just as damaging to the relationship.
What's the superhero component for the two you just mentioned?
Well, the superhero component is just that they're handling something in an extreme way. Let's take somebody who may be very social and very expressive, very fun. It comes across great in social settings, but sometimes that can go too far, and then they're the hypomanic. They look hypomanic, where that ends up being so persistent that they end up being pushed away. So like the very lovable donkey in Shrek ends up annoying Shrek. Shrek has to say, "Enough, donkey, enough."
And it is about balance. It's harder for them to find that inner balance, and yet therapy is something that can help them do that, correct?
Right. It's the ability I call it they end up wiggling the wedge. They get wedged in this middle. They can't enjoy the benefits of intimacy or the benefits of separation because it gets jammed in the middle. So yes, it's about helping them go the balance between closeness and closeness and distancing and being comfortable with that.
Yeah, that's what I thought. What are the red flags or signs that someone may have a personality disorder? And please describe the extreme reactions to intimacy, including a little more about wedges, which you've mentioned.
Exactly. So the biggest clue is that that it cannot handle closeness, or they have extreme reactions to closeness and extreme reactions to distancing. So when I'm advising people when they're going on a date with somebody, you have to test if something bothers you, you have to test the person. Dates should be about having fun, but it all should be about testing to see if they have a red flag, as we call it. So people will say to me, well, he or she showed up late, so it's a red flag. That's a red flag. Like, well, hold on. What's really the red flag is when you say, hey, I was getting worried about you because you're 15 minutes late. Then we see what happens. Because if they can handle closeness, they can handle distancing, right? Especially if they didn't apologize and now this person is saying it's upset them, they're going to react badly to that. What do you mean late? It's 15 minutes. Gosh, what's wrong with you? Right?
Yeah.
They're going to push back. But if they say, oh my gosh, I'm so sorry. I didn't even realize it was 15 minutes, or I didn't get a chance to call you. Please accept my apologies. It's not a red flag. They can join you in a discussion. They can handle that you're on a different page and bring the closeness by coming to this conclusion with you. And therefore, it's not a red flag.
And it's really about being brave enough to ask questions and explore, not hiding out in judgment and predetermination. You're a jerk because you were 15 minutes late.
Well, interestingly, it also helps me test whether they have a red flag, because people who are comfortable with their closeness and distance are able to say, I have this emotion to what happened with you, what's going on? But many of them go into the date and they just want to please or take over.
That's right. I that's my experience. It's real. And dating, there's so much right now about how dating apps are so difficult and people are tired of it. And so I think the extreme reactions are even more likely to happen just because of previous dating history and feeling rejected or feeling not seen or you know.
Right.
I think it's such a difficult thing. Would you help my audience by identifying and understanding the most misunderstood emotions in relationships? I thought that was such an interesting part of your book.
It is so common for people to have conflicts over their emotions. There's no such thing as a right or wrong thought or feeling, but many people are conflicted about anger, sadness, and neediness. Anger, they feel terribly guilty, so they'll end up, especially if it's at somebody they love, and they'll bury it, and it comes out sideways. Either explosion or an implosion. Sadness brings up a lot of shame. They feel like they're just babies or helpless or some extreme form of that, and therefore they bury that. And that ends up being a clinical depression or the forced positivity that we see in some people. And then neediness brings up embarrassment. People feel, this is so embarrassing, I'm so capable, I help everybody else, how can I have a need? And what they end up doing is bearing the neediness and being very resentful that someone isn't reading their mind because they don't want to say it, want to act it out a little bit so you guess what's wrong, and then they're even more resentful. No one isn't figuring this out by telepathy. So the three most common are anger, sadness, and neediness.
Yes. And the embarrassment is also about shame, feeling ashamed of and not know, maybe even awkward about how to deal with those emotions.
Yes, all three can really bring up shame and guilt. So
Yeah.
yes, you're right. Definitely, I see that too.
What are the 5 biggest mistakes we can make when communicating with someone who has a personality disorder? And I figure, personally, I think we all have a little bit of personality disorder. I've said that to people, because I just think we all can tilt in some direction that's not in somebody else's or our own best interest. So I love this idea of helping all of us communicate better.
Well, for starters, a lot of people come into my office that are in a relationship with somebody with a personality disorder have a tendency to want to take over that person. I need you to change. I need you to fix this. And of course, we know how changing somebody else goes. That never works. It really doesn't work here. That's one big mistake I see. Other, which is not as clear, but not as commonly known, is that you can just disappear, just pull back too far, and just sort of let them run the show. Just, okay, if you want to be that way, and they bury and hold, pretend they're okay. It just ends up in some other way causing a problem. Either, again, the explosion or implosion, but those feelings that they're burying end up coming out sideways. The other one is relying on logic instead of feelings. So people get into some kind of a talk about a disagreement, and they get into the fact fighting, right? You would never do this to anybody else. And you said this different last time, or just the pushing and trying to get them to be on the same page by trying to get them to think like them. Trying to get you to think, I'm right, so you need to think like me, as a way to get close. But that just pushes people away. The way to get close is to express how I feel about what you're doing. It's the understanding about how you feel about something that actually brings real closeness.
Yes.
So, and then expecting the mind reading. I touched on this a little bit, but when people aren't comfortable with any of those 3 emotions, and they start trying to show or imply or expect, because we've been together so long, you should know, I had to leave because you could have figured that out. It's such a disservice to the relationship. No one can help you with a feeling or something that's going wrong if you aren't able to tell the person what's going on. So being able to, again, express how you're feeling as opposed to hoping, figuring, or expecting them to figure it out is very important. Lastly, we have the whole getting caught in the weeds. That's an overused phrase, but it's so apt here. When they come in and talk to me, it's all about, your memory, or you're always going back to all these details. It's very important when you're dealing with anybody in a relationship, but certainly if someone has a personality disorder, to stop and think, when have I had this feeling before? When have we had this type of interaction before? How many times have we done X, Y, and Z? That information is so crucial, because when you go back to a pattern, instead of saying whatever the detail is, you say, hey, I want to talk to you about going on a trip with your family, but every time we have this conversation, we end up arguing. And I really don't want to do that this time. If you address the pattern, you're much more likely to get someone who's going to work with you on not arguing, as opposed to just attacking them about some detail.
A little more fact-based, and perhaps even the word evidence. We keep getting into this, and here's what happens, but not a blaming, this is all about you, but let's try to figure this out so we can do it differently, right?
Right. It's how I feel about those facts.
Yes.
You always want to do, from what I recall, you always want to drive to wherever. I like to fly. I get very anxious about being in a car that long, and that's why it bothers me.
Yes. And fattening up the reasons, not just, darting them out like you're throwing something at a dartboard, but really trying to talk about what's inside, even if it's muddled, or if you're confused about it, because that's sharing a vulnerability, and it creates a connection, because everybody understands mistakes and not being able to talk articulately about what it is that's going on.
Yes, it's a part of our humanity, our joint humanity, that we have these feelings and they've had them before, as opposed to trying to get everybody to agree about facts. You're absolutely right. And so being able to pause if you're overwhelmed. Say, look, I'm overwhelmed right now. I'm going to pause. And then I always say add a bridge statement. You don't just take off at that point because people feel that as a rejection or criticism. So you just say, I've got to just take a pause. I'll touch base with you at dinner time.
I like the bridge. I think the bridge is really important. A lot of people, I just have to go. I have to go. I have to get out of here. Well, let me walk around the block, but a little bit, and that helps you slow down a little bit too when you can make a bridge. So I like that a lot. People with personality disorders are often successful in life, but struggling with intimacy. What are 5 ways that they can nurture relationships besides communicating so that people understand what's going on?
Well, what we just talked about is actually the list for them, because what happens with people who are super successful is they are usually talking about being in a business situation or a social situation, especially a business situation. They feel that people are reading their minds. They feel like everybody's on board with them. But what they're forgetting is in a work environment, there are standard operating procedures. There's structure. There are people who have been there and done it before you, so they can help lead you or guide you, and you're getting compensated. When you go home and you rely on those same ideas or concepts that people are just going to fall in line, it's voluntary, and that's not going to go over well in an intimate relationship. So again, being able to talk things through with somebody, you don't have the final say. Not pulling back entirely when you have something that you need to contribute. So it's a partnership, not I'm in charge and you're the underling there. Also, at work, we don't talk about our feelings because there's one goal, and that is to produce or make money. But in an intimate relationship, the goal is to get close. So you have to talk about how you feel about something, unlike at work. So, and then also look for patterns. At work, we do look for patterns, but someone else is doing that job and then tells you the pattern. In a relationship, you have to explain the pattern and get their version of what patterns do they see. It's going to be different than yours. But all that's very important to maintaining the closeness and distancing that an intimate relationship relies on.
Yeah, I think so. How can people express their anger in their relationship without being hurtful or destructive?
I love this question because it gets right to the heart of people have this terrible fear that by saying they're angry, it's going to be destructive. And so I'd love to give the script the me, you, we script for that. The me part is being able to say the I feel X when you do Y. I feel angry when you show up late without warning. But you just stop there, you're most likely going to go get some kind of fact fighting from your partner. Well, I wasn't late. And what's the problem with that? And so instead, you want to then say what you think their version is. That's your empathy. What do you think they would say back, or what do you think is going on in their mind? You say something along the lines of, and yes, I know that you don't do this on purpose. So how are we going to, the we part, how are we going to work this out? By that, you've already evened out the field there. I have a hurt, you have a hurt. Let us work together so we're side by side attacking the hurt, resolving that hurt, as opposed to attacking each other.
Yes. And it requires vulnerability underneath the anger. It requires exploring what you imagine the other person is, why it's important to them to do this thing that's terrible or annoying to you, and imagination about yourself and how you're feeling about it, and being able to soften it so it can be not another dart thrown, but a connection. And this is all about having more connection.
Right. Another point that you just brought up for me is that when you understand and listen to your partner's point of view, it's not the same as agreeing with it.
Yes, that's right. Yes.
It just means I respect you enough, appreciate, respect that you have a different viewpoint. And you also don't give up yours. Because so there's some people, back to the dependence personality disorders, where they just go, okay, whatever you want, it's fine. But you can't do that either, because that's actually a lie. And that's one of the wedges, right? I'm going to not be fully honest with you, but I'm also not going to cause a fight to get too far from you. But it's not honest, and it's not something that's tenable.
Yeah. Boy, I really wish that I could have had someone like you teaching me a long time ago about that, because what you're really amplifying for me is that it's really is this roller coaster between super closeness and super distance, and it's about defenses. Is it, we don't have more information if it's wired in the genes or it's nurture or anything like that, right?
It's nurture.
It's nurture?
It's nurture. These patterns are what parents are supposed to teach their teenagers. This is why I get so frustrated when parents are taking away the phone or taking the door off the hinge. Where does that translate into the pattern they're going to use in their relationships going forward?
I remember saying to my kids, I'm really angry right now. And of course, I still love you. You know, we have to figure this out. But trying to teach them at the time, because I'm a Gestalt person, teach them you can feel two different things at the same time, and one doesn't have to erase the other. I think there's so much hierarchical thinking and feeling where, and I do this with people. I'll say it's not all this or not this. It's two opposite things sit next to each other. That yin and yang, if I'm pronouncing that correctly, that are in the circle and learn. And I think wisdom is being able to hold that duality. And what you're saying is personality disorder people really struggle with holding that duality.
Exactly.
Yeah, that's really interesting. I really wished I had understood more earlier in my career. I think it's such an important topic. And if people can begin to understand how they get stuck in those two extremes, and what I call you call the wedge, no, I call it the messy middle. What do you call it?
I call it the wedged in the middle.
The wedge in the middle. Okay. And you know, I'm always saying to people, it's not 1 or 10, it's 4, 5, 6, and 7. It's not black and white, it's gray. It's one of my big messages that I repeat an awful lot. And that's why I think we all have a little bit of personality disorder, you know, attached to ourselves and our own souls, you know.
Well, then you're coming right back to the beginning of our conversation. It's absolutely true. It's just...
So it might even be better if people understood that we don't have to necessarily label it as personality disorders, but being able to think about all relationships struggle with that balancing act of too much closeness, too much distance. And thinking about it would even be helpful, just understanding that as a pattern and how you contribute to your own needing closeness too much or needing distance too much, and what you can do about it. And if everybody thought about that a little bit more, we talk about it, but I don't know. There's just something about the way you're describing it that I think is really important.
Right, and that also goes to the question, when you're with somebody with a personality disorder, you have to realize that sometimes they're shutting down, not because they're mad at you or not because they're just saying wrong, but because they need that distance. So I always say, just let them have their space.
What are the 4 different argument styles, and how can we recognize them? How can we recognize which one is ours and what to do about it?
So people tend to, the personality disorder, relationship problems, tend to value either aggression, they see that as being strong, or overvalue passivity, they think is being kind. But really, argument or any discussion need to know when the value of using both.
Yes, I would agree completely with that one. For those of us who are constantly walking on eggshells with our partner, what are some steps towards smoother communication?
Then start talking. I have many examples of this as well in my practice where they feel like this is some kind of a confinement, that this is something they have to do. What would happen if you went to your partner and say, listen, I get the sense you're angry, upset about something, and you're very tense. And I also get the impression you're not willing to talk about that. So I'm going to go about doing my work and then going off to the office. And when you are ready to talk about it, I'm ready to listen. You basically pull it up into conscious awareness instead of just going around thinking you can't do anything. You're not a prisoner. You can talk and lay it out and put it back on the person. Right? It's a form of destructive passivity when you're just resentful and won't talk except for terse words. That person's just confused about what you're doing and why. They're not going to guess from that they need to do whatever you want them to do. It's much easier and more reliable if you're able to say, I'm really annoyed about this. I need some space. I'll touch base with you later.
I'd like to explore borderline personality disorders. How would you describe them, and what is most misunderstood? And what are some of their partners' chief complaints, and what can partners do to improve things?
Okay, so people with borderline personality disorders use three main components to stay wedged. They use a lot of drama. They have an identity that's called diffuse, meaning they're not really solid in their identity, and they're very impulsive. And so those three traits are what keeps them safe. It kind of helps partners involved with them as they realize this is a way to stay safe. It isn't a way to torture you. It isn't a way to hurt you. They're not doing this on purpose. This is the deal with the conflicts they have over closeness and distancing. So again, people in those relationships will get caught up in the drama, especially if it involves self-harm and extreme reactions to things, and they try to placate and solve and fix as opposed to, this is not working for me, it's upsetting me very much, I'm going to pull away from it. Or like I have had some people do it, I'm going to call the authorities. That solves it really quick because A, you're taking it seriously, and B, you're bringing in reinforces this is serious. You can't just drama to the point where you're worrying people without having some consequences. So bringing in and not trying to solve it, but trying to ameliorate it. This is not going to work. And the same with the identity diffusion. Help look, give me this impression, now you give me this impression. I need just one version. What is your opinion or view on this? Sometimes you have to sit them down and get the answer that you need as opposed to trying to get them to change.
And my last question, how about narcissistic personality disorder? Yes.
Well, we all know grandiosity is one of their main ways of staying wedged, of dealing with the conflict. Superficial, they stay very superficial. It's very hard for them to get into something very deep. In that same vein, they tend to skim on highlights. They just want the highlights. Because as soon as someone starts getting deep into something that they don't know, that threatening distance comes up. And they have to reverse it. They reverse the distance by one-upping, the whole I do this best, or they just disengage. Right? So the superficiality, again, it's not to take it personally, but to realize that this is what they do to keep safe in their mind. And you might want to start if you want to get deeper in a conversation, you might have to frame it that way first. I want to go a little deeper. And you might also want to say, I know that you are very good at X, but I'd like to talk about us both getting very good at Y. If you frame something they're very good at, it helps all those three issues that they have come into focus. They get the praise and this joining me in going further, as opposed to I'm over here and you're over there. Let's we're both smart on these two things. Let's join together.
Anything else you can tell us about reminding us of your book title and your website?
Well, you had said my website is drldadmy.com, and that is true. That's my personal website. But I did start relationshiprx.com and as a way for people to get resources beyond my book, free resources, and also not everybody needs therapy. I realize that over the decades I've done this. And so I do relationship consulting on that site where I just talk to you once or twice, give you a new way of looking at something. And sometimes that's all people need. So it's a way to get help without having to get involved in therapy or group sharing.
There you have it, an adventurous journey through the intricate world of personality disorders and relationships. Navigating these connections can feel like a roller coaster ride, but with the right tools and insights, you can make it to the other side. My website, therapyideas.net, has over 450 pages of free information, so give it a look.